Health Secretary Robert F. Kennedy Jr. facing some tough questions today. House lawmakers grilling the secretary about his agenda, including changes to the childhood vaccine schedule. One Democrat asking about last year's measles outbreak in Texas that resulted in nearly 800 infections and the deaths of 2 children who were not vaccinated. Take a listen.
Do you agree with the majority of doctors that the measles vaccine could have saved that child's life in Texas?
It's possible, certainly.
Okay, thank you.
NBC News medical reporter Aria Bendix joining us now. Aria, Secretary Kennedy, known, of course, for his controversial views on vaccines, and he's claimed the U.S. has done better at preventing measles than any other country. What do the numbers actually tell us about that?
Right. So Secretary Kennedy often points to higher case numbers in Europe as evidence that the U.S. is doing well. Experts tell me that's really a false comparison. We have to compare how the U.S. is doing currently to how it's done historically. And the fact is that last year, we had a record-breaking number of measles cases, nearly 3,000 in the U.S. We saw 3 deaths from measles, even though we hadn't seen a measles death in a year prior. And we're now on the verge of losing our elimination status, if we haven't already. So the numbers don't tell a good story, and experts say that's really due to low vaccination rates and a lack of pro-vaccine messaging from HHS.
So we've seen a generational increase in measles infections.
Certainly.
Ongoing right now. So, Ari, also, I know there was more business to be handled here. I guess Kennedy had announced the overhaul of that panel that's going to determine, this is consequential, which preventive services insurers must cover. Folks are going to be watching this closely. What does that mean for most Americans?
So we've been anticipating this announcement, actually. Kennedy has now confirmed that he is going to overhaul the panel and appoint new members. Now, the panel has come under fire recently for being slow to make changes based on new science. But the bigger fear among medical groups is that a group appointed by Kennedy could actually make decisions without any evidence to back them up.
Are these appointments typically political, or can they be historically?
No, these are highly trained and qualified scientific and medical specialists that make these decisions. And as you mentioned, this can affect insurance coverage across the country for things like cancer screenings, infectious disease screenings, so much more.
Some really important context. Aria, thank you so much for that. We appreciate it.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.